Good evening to everyone and welcome to today's session. After the recent last week discussion of AIMS November paper, once more this week PGI is only a recapitulation of history. The topics are same as what we predicted from the high yield topic list of 1132 topics. Even you don't need to read all 1132 high yield topics, just 50% of them from the top of the list will enable you to survive the exam. So we welcome Nandu, Monty, Pradeep, Sai and everybody who are online. Actually, the people who had gone for PGI exam, they didn't return. If it is AIMS exam, it is in Bangalore, Hyderabad, everywhere. I mean Bangalore and nearby places. So around 100 questions we are able to recall. Remaining questions they have written in while in the train. So maybe we need one more session, part 2, to complete the remaining part of the questions also. But it is worthwhile because this analysis is important. Ultimately, what is going to be APPG or AIPG, everything comes from these roots. That's the reason analysis of the question paper is very much required. Can the online students can punch whether the voice is loud and clear for everybody? Yeah. Posterior inferior cerebellar artery pica typically supplies what? Last week only we discussed lateral medullary syndrome in our neurology class on Sunday. So doctor, we have lateral spinothalamic tract and central tegmental tract. They both are passing along the lateral aspect of the medulla, which is supplied by your posterior inferior cerebellar artery, pica. There are structures which are there in the medial aspect which lead to medial medullary syndrome. So what are all the structures which are there in the posterior inferior cerebellar artery territory in the lateral aspect of the medulla? Vestibular nuclei, inferior cerebellar peduncle. What does it connect? Cerebellum with the medulla. And similarly central tegmental tract is in the lateral medulla. That's the reason palate will show myoclonus if there is a lateral medullary syndrome. Similarly, lateral spinothalamic tract also is in the lateral aspect. Then spinal trigeminal nucleus and tract and nucleus ambiguous and sympathetic fibers, they are all located in the lateral aspect of the medulla is what you need to basically remember. Whereas the hypoglossus nerve fibers, third, fourth is in midbrain, 5, 6, 7 pons, 8, 9, 10 everything is in medulla. So hypoglossus which supplies the tongue, it is located in the medial aspect of the medulla is what you have to basically remember. I think Vizag, Monty, Pradeep, everybody the voice is loud and clear. Good. Similarly, medullary pyramid. What is the significance of medullary pyramid? All your dorsal columns will ascend up and at the medullary pyramid they will decussate to the contralateral side. So they are also in the medial aspect of the medulla and they are not involved in lateral medullary syndrome. Okay, doctor? So what is the carry home message for the next All India PG entrance you are going to go? Brainstem circulation, brainstem strokes, 100%. You expect it and go to exam and it will be there in the question paper. Take it as my word. Okay, doctor? Now, what are the derivatives of mesonephric duct? Paramesonephric and mesonephric, the two types of the embryonic ductal system. Female paramesonephric duct and male mesonephric duct. So, ductus deferens, seminal vesicles, epididymis. Easy to remember the derivatives of mesonephric duct. You can remember Gardner's seed. So, Gardner's seed because Gardner's duct, seminal vesicles, epididymis, ejaculatory duct and ductus deferens, they are all derivatives of mesonephric duct is what you need to remember. Now doctor, what are the walls of orbit? PJ is very predictable exam, let me tell you. It is not like AIMS. AIMS is like Paxigene is what, Pixigene is what, they will eat your brain. PJ is not like that. Its business is straight. Do you know subject or not? Do you know 10 factors leading to hypercalcemia, hyperkalemia? Do you know or not? Examiner will check you straight away. So, cracking PGI, DNB CET, AI PGME fall in one line. Cracking AIMS in Andhra Pradesh, NIMS entrance, they are all, and the AP state medical entrance, they are a class apart from that of that stream. Whatever the class they belong to, ultimately that high yield topic list is all. We got a lot of requests to host it on the newsformedico.com. The high yield topic list. Tonight we will host it on the newsformedico.com. Now, lateral wall of orbit. What is it formed of? Lateral? You have a greater wing of sphenoid, is there, no? Orbital plate. Yeah, that's right. So, lateral aspect where you have sphenoid bone, supraorbital fissure, zygomatico-temporal foramen, zygoma bone, etc., etc. So that is the reason the lateral wall is basically formed by frontal process of the zygomatic, and the orbital plate of the greater wing of the sphenoid is the one which typically forms the lateral wall. Why lateral wall? Because lateral wall is highly vulnerable to injuries. That's the reason we need to basically remember. Last time in Tirupati, Dr. Naidu and his friends contributed with all 4 options, lot of recalled questions, but they are all in train. I think they have written about some 200 questions. We will try to complete the paper. So, Verruga peruana is caused by what? A question in dermatology. This is not in high yield topic list. 10% questions will not be there in the high yield topic list. That's not a thing to worry. Bartonella bacilliformis typically will lead to the development of this kind of wart-like structures, which is basically called is called as Verruga peruana. Probably some questions on psoriasis, some questions on pityriasis, some questions on lichen planus. We will get all those questions recalled. First some 100 questions we recall, that we will discuss today. You should accept our limitation. And tomorrow we have a very good masala paper as our mock test. We'll have weekly 2 mock tests, Wednesday and Sunday. So we'll have a discussion from evening 5 to 8. Tomorrow 2 to 5 will be the mock test. So apoptosis. AIMS paper mein you have seen apoptosis. Next week you are going to write JIPMA. You see, once more apoptosis will be there in JIPMA. Without apoptosis there is no question paper. 100-200% मैं लिख के देता हूं आपको. So what is the question this week? What is not seen in apoptosis? We don't see inflammation in apoptosis. Then how is endonuclease activity? Typically apoptosis lead to increased endonuclease activity. That's the reason the DNA become fragmented. And if you do electrophoresis, what you find? Stepladder pattern of the DNA is a very classical finding, is what you need to remember. On the plasma membrane we discover bleps, which is a very characteristic feature of the apoptosis. Microsatellite का weight कितना होता है? This is not in high yield topic list. 20%, 10 to 20% questions will not be there. They are equally Surprise for everybody. No big deal. You need to play a little sportive if you have negative marking based exam. So basically 2 to 6 base pairs. A small sequence of repeated nucleotides of 2 to 5 base pairs in the DNA are called as microsatellites. So what is the purpose of microsatellites? What is the stability of microsatellites? That's a little larger story. Don't go into that story. Just because this question came in PGI, don't become PhD in DNA. You have working knowledge in DNA. Now doctor, one CD marker, without that there will be no question paper. It can be lymphoma, leukemia generally. But this time examiner asked what is the CD marker for Langerhans cell. CD1A, CD14 and S100. They are all out of that CD1A positivity is a very specific feature of the Langerhans cell histiocytosis. S100 is also expressed and CD1A antigen CD207 is a Langerhans cell restricted protein is what you need to basically remember. This is a very traditional question. Psammoma body, what are all the conditions that you see? So these are the typical calcified concretions which can be found in meningioma, papillary carcinoma of the thyroid, etc., etc. So doctor, there is a big list. Papillary renal cell carcinoma, lung adenocarcinoma, ovarian papillary serous cystadenoma, endometrial adenocarcinoma, meningioma, but generally examiner will ask meningioma, papillary thyroid carcinoma. Maximum you can remember. Now doctor, which is a conjugated hyperbilirubinemia. PGI is an exam of straight business. There is no humbug about anything. Examiner wants some things from you, you give them and take the seat. Simple. Right? So, what are the causes? If you look at the big list of causes, hemochromatosis, mets to the liver, and also large hematoma, large hematoma lead to unconjugated hyperbilirubinemia. Don't include large hematoma. Okay. If you look at Gilbert syndrome, Gilbert is another important situation where there is a decreased hepatic conjugation and leading to unconjugated hyperbilirubinemia. But what examiner asked is conjugated hyperbilirubinemia, only A and B, not D or C. Okay. I leave the literature for you. All these things are there on the newsformedico.com. Some of you are going for JIPMER exam, right? So we have hosted all questions of the JIPMER 2014 and JIPMER 2010 paper also we discussed. The video of the JIPMER 2010 paper also along with the questions and explanations we have posted it on the newsformedico.com. And NIMS paper, NIMS 2014 paper also we have hosted. You can go through that. If you register through the login button, you will keep getting everyday automatic updates. Whatever the new things are uploaded, that they will be sent as a RSS feed to your email. So if you have not, please do register. Now, adrenocortical carcinoma. If you take pheochromocytoma, what is it? It is there in the adrenal medulla. So, it doesn't produce any vinyl mandelic acid. Then, will it lead to metastasis? Lot of times by the time adrenocortical carcinoma is discovered, already it is metastasized to the distant organs. That's the reason the 5-year survival is only 20 to 35%. By the time you detect the presence of the adrenocortical carcinoma is what need to be remembered. Right. What are the factors that increase the risk of urinary stones? Another very traditional question. Right. So if you look at the urinary citrate, what is the purpose of urinary citrate? Citrate prevents the development of urinary stones, and similarly any increase in the urinary colloid, what is the effect of it? Typically high dietary intake of animal protein, or if fructose is there, or grapefruit juice or apple juice if you happen to take, they will typically have the effect of causing an increased risk of renal stone. So I leave the literature for you. Similarly, in the renal tubular acidosis, is it proximal or distal renal tubular acidosis that lead to development of urinary stones? Favorite MCQ in entrance. Once more, JIPMER में वही क्वेश्चन आएगा देखो. तो distal renal tubular acidosis, hyperparathyroidism, hyperoxaluria, medullary sponge disease, they all predispose to the development of the renal stones is something which you should not forget. Congenital adenoid malformations. Typically, whenever a congenital adenoid malformation is there in the lung, okay, it will lead to contralateral shift of the mediastinum and lead to pulmonary hypoplasia on the other side. So that is the reason. And one more situation where a similar thing can happen, suppose if diaphragmatic hernia is there, it also will herniate into lung and lead to contralateral shift and pulmonary hypoplasia on the other side. So the close differential diagnosis for this is an example of a adenoid cystic malformation leading to the development of here adenoid cystic malformation. This one is leading to shift of the mediastinum to contralateral side. Now, can you be able to detect it prenatally with ultrasound is the question. Yes sir. So this is how you can conduct a prenatal ultrasound. Nowadays on the fetus only they are doing surgery if they discover the presence of congenital adenoid malformation. Some of you are going to be finest cardiothoracic surgeons in a short period of time after finishing MS general surgery. That's my dream for all of you. Right, doctor? Now, laparoscopic surgery. What type of needle is used? In order to insufflate the gas, we use Verres needle is what need to be remembered. Is a previous abdominal surgery is a contraindication is what the examiner asked. Earlier days it used to be, but in the modern time it is only treated to be relative contraindication, not a absolute contraindication. Then earlier they used to put multiple ports and do the laparoscopy. Now what is the new technique? It is to basically put a single port underneath the umbilicus and then do the single port laparoscopy. SPL is considered to be the newer technique. There may be two more options on the same thing. The people who recall the questions could not. So when we post it online, automatically if you have taken PGI exam, you can add in the discussion below the blog that you can do, so that will help the next round of students. Okay. Renal transplant surgery. Let me tell you, doctor, heart transplant, renal transplant. What are the immunosuppressive drugs used in the renal transplant? Very high yield topic in surgery. In the list 1132 high yield topic list given to you. So doctor, what are the important principles? You will place the transplanted kidney not in the renal fossa, but rather you will put it in the right retroperitoneal iliac fossa is the classical location. You will anastomose the renal artery of the transplanted kidney to the patient's recipient's iliac artery. And renal vein is anastomosed to external iliac vein. And between venous and arterial anastomosis, which one will you do first? Venous anastomosis first and then comes the arterial anastomosis. I leave the literature for you as to what are the funda behind the why only right, why not left, or why only left, why not right. All the discussion I leave to you in the literature. Basically left iliac fossa you will use mainly for the pancreas transplantation candidates. That's the point you need to understand. And once more, the type of anastomosis which you do. Is it end-to-end anastomosis or end-to-side anastomosis? So it is the end-to-side anastomosis is the most common technique that we'll use when you are ligating the renal vein with the external iliac vein is what need to be remembered. So if you go to anatomy2medicine.com, in the surgery list of video lectures, you have renal transplantation. If you are not very sure of this, you can review that video so that will help you to revise fast. So after listening this, while you are preparing for the exam, no, you must be sure, this was asked recently, so your focus will come, your interest will come to read. That's my idea. Raised intracranial tension. Last time AIMS में क्या पूछा नवंबर में, AIMS November 2014, Cushing's reflex was the question. So raised intracranial tension is there in the question bank में buzzword. See, even examiner personally won't write questions for you. He will tell computer Mahashay, please give the questions. So it will pick up, and from where will it pick up? From what people kept inside. How did the people kept inside? They have chosen a set of topics and then accordingly framed 5-6 questions and kept inside. So we did a retrospective analysis after going through the questions in the frequency they are coming as to what are the main headings, main topics the examiners, most of the examiners across country have chosen in various exams. So that is the reason if you go through that list, that is very important. That agenda must be there on your table. What are the 30 topics in physiology I am going to read? Not more than that. What are the 50 topics in biochemistry I am going to read? Not more than that. That too, what is the first topic I am going to start? Your agenda must be clear. Microbiology means first topic you should open is streptococci. Pathology means first topic you should open is glomerulonephritis. 4 to 5 hours pathology पढ़ना entrance के लिए खत्म हो गया बोले तो by the time apoptosis should be over, glomerulonephritis should be over, inflammatory mediators must be over. Like that. Time is money, doctor, like a Supreme Court attorney. You should be preparing, keeping time as money. Then only you will get the seat. Now, raised intracranial tension. Typically, not increased heart rate, sorry, bradycardia will be there. A is not there. There's a correction. Then increased blood pressure and systolic BP will increase, pulse will decrease and abnormal breathing pattern will be there in the case of the raised intracranial tension. When will you do surgery? Within 1 year. See, last time यही question पूछा ना एम्स में, cleft palate का prepare करते, तो entrance को prepare करना होना कुछ difficult job है क्या? नहीं. If you know that cleft lip, cleft palate कैसे भी पढ़ना, what is the rule of 10 in cleft lip prepare, doctor? 10 pound should be the weight. Hemoglobin should be 10 milligrams. Then 10 months is the age. 10 months or 10 weeks? है ना? That's important. So doctor, once more, Jipmer also there will be one cleft lip per palate. Jipmer also, which is going to happen next week, one apoptosis will be there. So that's the reason those who know that Sukshma will get moksha. So that is very important. Now, typically cleft lip repair if you take, it should be surgery of the palate is done between 9 to 15 months, generally after 1 year, but cleft lip will be done between 2 and 6 months, 2 to 6 months, ideally around 4 weeks, 4 months means around 10 to 12 weeks during that time is the time where it is done. If it is a bilateral cleft lip, typically you will do 8 weeks after the first operation, first clip. First side surgery, that's the point. One question on Glasgow Coma Scale, without that there will be no paper. So you must know, doctor, what is eye opening may 1, 2, 3, 4, 4 scores will be there. 1 is none, to pain, to speech, spontaneous eye opening. Then verbal, none, he moans inappropriate words, confused and oriented. Examiner gave confused. So it should be V4, right? Then motor, none, abnormal extension is worse, flexion is better, withdrawal to pain is much better, localizes the pain is much better, follows commands is basically much better. So accordingly, don't forget doctor, one question on the Glasgow Coma Scale. Now what is the difference between Paget's disease and that of the eczema? Generally eczema involves areola, not the nipple proper. But if the nipple proper get affected, then typically it will be Paget's disease where the nipple get destroyed. And one more important point you need to know is how will be your patient for Paget's disease doctor? Typically a 40-45-year-old female, her blouse is completely wet because of the secretions and she feels very itchy about the breast, and that is how she basically presents. Okay, so nipple is the one which is basically involved in the case of the Paget's. Areola is the one which is affected in the case of eczema is what need to be remembered. Then about BPH, yeah, Chandu is saying micro videos and pediatric videos have an issue of playing. Just to please ask them to check that. Any problem is there with the video library, sometimes it can be there. You can call the helpline and inform, and they will take a immediate remedy. So no problem. Now in BPH, where will the growth occur? Typically periurethral zone is the place centrally is BPH. Peripherally, that's the reason if you do parietal examination you can feel it because it is growing peripherally. Which one? Cancer, prostate cancer. That's the thing you need to basically remember. I think recently what was the question in AIIMS November? Goserelin. Was it in AIIMS November only? Or our mock test? Nowadays there are too many tests. Goserelin. AIIMS. So prostate hypertrophy or cancer. Each will have some 10 traditional questions. That wo pakad ke exam ko jana. Now, duodenal diverticulae. This was a recent our mock test MCQ. So duodenal diverticulae ke liye, these are the classical diverticulae. What is the commonest site is a very important question. It is duodenum, which is the commonest site, and it has no malignant potential. It involves periampullary area. It can lead to pancreatitis, and typically it is twice common in women than in men. The option C, D, E, I am not sure whether they are there in the actual exam or not, but they are the main issues about duodenal diverticulae. It is a little reconstructed question. Hand-held retractors which are used in surgery are which ones? Once more आपको ऑल इंडिया पीजी में एक इमेज आ जाएगा, एक रिट्रैक्टर को दिखाएगा और एग्जामिनर will ask you what is this retract. Surgical instruments, you should have at least an idea what is the name of, eponymous name of that. Legenbach and Homan, both of them. So Legenbach and Homan are considered to be the hand-held retractors in order to retract. That's very important. Then this is the Jalpi retractor. Jalpi is what surgeon will be shouting. So surgeons, every surgeon will have his favorite anesthetist and favorite nurse. अगर वो नहीं आए तो he is like a musician without a proper tabla and proper violin. Really also. And there are surgical theatre nurses who will emotionally blackmail the surgeons. आज मैडम को मूड नहीं है तो सार का सर्जरी करना बहुत मुश्किल हो जाता है. If she doesn't cooperate, he cannot do anything. He is like a impotent, virile surgeon. So that's the reason they will treat. You need to know how to treat surgical nurses very respectfully, carefully, take care of them. So etc. etc. So and actually surgical compared to ward nurses, surgical nurses, their IQ also will be much sharper and their reflexes are sharp. So as a young house surgeon, we used to have Sister Mary. So she used to hold the back and pull back. What doctor, while putting sutures, if you incline forward, by the time first surgery only your back is gone. So starting from how to incline your back, they will teach you. From how much pressure you have to hold at the time of applying pressure on retractor during a gynecological surgery. So that's the reason, and similarly emergency medicine nurses also, they will be very good with dobutamine, dopamine, nitroprusside, all the drips reflexly they will be knowing how to basically do. So that's the reason we learn from everybody, doctor. Patient's story is a learning. The ward nurse will start telling you some basic funda which are unforgettable, senior nurses. From there, by the time you are in second year MD and MS, you are expert. But fundamentals, some basics of, I still remember, every day in MD I used to take, when I joined NIMS, I used to take up to 7:38 by the time I finish ward work. No time even to buy slippers in MD General Medicine. Simple bathroom sandals also kharidne ke liye time nahi. Once I remember going to the Bata showroom and he closed. I felt frustrated. What is this life? So many night duties and all. So one day, after seeing me for few days, the ward nurse said, no doctor, these are the first things you have to do, these are the second things you have to do, that's how you have to finish ward work by 4 o'clock. So this is a good technique. So that way, post-graduation is the most memorable period of life and you are all dreaming to get into that, and I wish you should all be PGs. 2-0 suture ka diameter kitna hota hai? What did I tell you? High yield topic is one type of suture to jarur puchega doctor, which are absorbable, what are non-absorbable sutures. Isme agar mistake kare to you are out of competition, don't forget. So you have polyglactin and polyglycolic acid, caded chromic suture, and I leave the literature for you. What are absorbable, what are non-absorbable sutures. You need to have clarity. Then once more, the United States Pharmacopoeia scale, it is called. 60 means 0.07 mm, 50 means 0.10, 20 means 0.30 mm is what you need to basically remember. This list, you have to remember it thoroughly, doctor. Now, because this kind of questions have high vulnerability for repetition. Huckel's principle of as the generations pass, certain characters repeat, right? So don't forget. Then breast carcinoma, definitely one question should come, no? That's a deal. So what is it associated with? Peutz-Jeghers has an association, Cowden's has got a association. What is Cowden syndrome also called? Multiple hematoma syndrome is what you need to basically remember, which is basically called Cowden's, which has an association. Similarly, in the women who have Peutz-Jeghers syndrome, the risk of breast carcinoma will substantially increase. That is another important finding that you need to appreciate. Thyrotoxic shock is there. What is the drug used to manage congestive heart failure? So, if esmolol is in the options, esmolol is the answer. Don't forget. So we use esmolol. We also can use propranolol to bring down that sympathetic overactivity in thyrotoxicosis. Diltiazem among the calcium channel blockers is also used in order to manage a thyrotoxic shock, is what I want to underscore. Once more, one more favorite question of examiner is what? Myxedema coma. How are you going to manage? Diabetic ketoacidosis is another one of the 4 to 5 common emergencies in medicine. Status epilepticus, thyrotoxic crisis, myxedema coma, pericardial tamponade, pneumothorax management. The other day they gave agar pneumothorax spontaneously hit, what will you do? Second intercostal space mein stop kar dete. One emergency medicine question will be there among these common emergencies. Now, which antibiotics act on cell wall inhibition? I think easiest question on the planet. Give me your answer, doctor. let us make a bit interactive. Very good. I am happy to see 44 online viewers. Yeah. Huh? After the discussion is over, when you go back home, go to the News for Medico and review the JIPMER paper. JIPMER paper which is hosted on newsformedico.com. I think I told you. Huh? Right. Now, chalo, what is your answer? A and B, not C, not D. What is daptomycin? Don't say it is gentamycin's big brother. Huh? Question number 25. Online students can punch their answers. Yeah. Punch their answers so that we want to see that we are all participating in discussion. Posner Schlossman. Do we have Africans and maybe because this is entrance time, people are changing their name and to remember, for 1 week you be Ewing, so that you will not forget. You ask your friends to call you Ewing. So, Posner Schlossman proposes ABD. Yeah. Chandu is saying A and B, Shiva is saying A and B. Why you are not having courage to commit on D? That's daptomycin. So doctor, penicillins, cephalosporins, carbapenems, monobactams, they are all basically what? Cell wall synthesis inhibitors. Even vancomycin, bezitracin, they are also cell wall synthesis inhibitors. Then you have a cell membrane inside it. Polymyxins act on that. Very important table, doctor. Entire bacteriology, entire antibiotics, यही इसी में है. One question JIPMER में और एक बार आएगा, आप लिखते वक्त मुझे याद करेगा. Folate synthesis is trimethoprim sulfonamides. Quinolones, glivofloxacin, levofloxacin, they are all DNA gyrase. RNA polymerase is rifampin. Then 50S subunit, you have macrolides, clindamycin, linezolid, then chloramphenicol and streptogranins. Then 30S subunit is by tetracyclines and aminoglycosides. One question जरूर आएगा, पॉकेट में कट करके जाना एग्जाम को. Next. Dapagliflozin is what? First of all, it is a diabetic drug. HIV drugs, diabetes drugs, epileptic drugs, Parkinsonism drugs, antiarrhythmics. Totally 20 classes of pharmacological drugs you have to be having the things in your tips. Okay. Diabetic drugs, no compromise. Okay. So what is dapagliflozin? It is a newer anti-diabetic. Normally you are having SGLT1. What is SGLT1? SGLT2, sodium glucose transport protein. What it will do? It will lead to complete reabsorption of the glucose in the proximal tubule. Na? So then they thought, kitna bhi sugar khane do, diabetic patient, we will create a glycosuric condition by inhibiting the SGLT2. बोल के idea आ गया. Maybe he didn't get seat in MD, so he has a lot of time on doing some path-breaking research. So it blocks sodium glucose import is correct. It inhibits the subtype 2 of the sodium glucose transport protein. By doing that, it will lead to glycosuria. Every time glucose goes away, it will carry water with it. So polyuria will also be there. But if there is a lot of glucose in the tubule, it will be breeding infection. So increased urinary infections will be there. And since the patient is losing lot of water, he can end up in a hypotensive reaction. Everything explained if you know the mechanism of action. So dapagliflozin is what you need to remember and look forward for the drug when you happen to go for the next All India exam or any exam. But what is precautionary thing that you should take today only after going home? You should read diabetic drugs. Immediately open करके फटाफट वो pharmacology book है ना त्रिपाठी में. We had been postponing since long period of time to read that. So फटाफट एक बार half an hour में खत्म कर देना. ये सेशन अटेंड किया, ये क्वेश्चन भी आया बोल के मालूम है, डायबिटिक ड्रग्स इज हाई यील्डिंग टॉपिक भी मालूम है, और उसको कल पढ़ेंगे, परसों पढ़ेंगे, बरसों के बाद पढ़ेंगे. आप पोस्टपोन करें तो दैट इज नॉट द कैरेक्टरिस्टिक फीचर ऑफ ए टॉपर. ओके डॉक्टर? हाँ. देन मेटफॉर्मिन, व्हाट विल इट लीड टू? One more diabetic drug. So आपको मालूम पड़ गया ना, पूरा फार्माकोलॉजी बोले तो ये पढ़ना वो पढ़ना नहीं है. शुगर बीमारी की दवा क्या क्या करते, कैसे इस्तेमाल करते पढ़ना. एग्जामिनर वेट कर रहे हैं आपको मालूम या नहीं बिफोर गिविंग पीजी सीट. Okay, so it lead to GI disturbance. Lot of times your metformin receiving patients will tell, doctor, lot of gas is going, doctor, what to do, doctor. Very embarrassing situation when we go to social function, they will tell you, right? Causes GI disturbance. And since it inhibits the gluconeogenesis enzymes, if the glucose cannot be metabolized, then it will be pyruvate convert into lactic acid. So lactic acidosis will occur. But it is called a euglycemic drug. That's the reason hypoglycemia won't be there. And they are the important principles on metformin. Okay, doctor? Now, proton pump inhibitor. PGI is an exam of true business. You know it, you read it, quantitatively you will get the good seat. Hit and run drug. मतलब क्या है? If proton pump inhibitor is given, it leads to irreversible inhibition of the proton pump. That is the reason, even though the half-life of the proton pump inhibitor is only 1.5 hours. आप जो पैंटासिड लेते हैं, उसका half-life 1.5 hours ही है. मगर आप आज बीर पिए, कल भी बीर पिए, फिर भी रिफ्लेक्स नहीं होता. क्यों नहीं होता? क्योंकि since it leads to irreversible inhibition, the action of it will be little longer period of time. Hence it is called as a hit and run drug is what you need to basically called as. What kind of medium does it basically you need to remember. So what kind of medium that it requires? The drug will bind covalently with H plus K plus ATPase, but it requires an acidic medium for it to optimally perform and act. They are the important issues on PP inhibitors. So what TB drugs will have renal excretion? Once more, one TB drug, just like HIV drugs, examiner's favorite area. So if you take the amikacin, ethambutol, they both have a renal excretion. Whereas INH, if you take, predominantly it is the hepatic excretion. Pyrazinamide, if you take, it is also metabolized predominantly in the liver, and the end products of the pyrazinamide metabolism are excreted in the kidney. That's the point you need to understand. So what are the benzodiazepines that we use in the management of seizures is a very important question. Huh? Yeah. Posner Schnossman is once more telling the actual question was drugs needing dose reduction in renal failure. So the language इधर उधर है मगर ultimately अर्थ एक ही होता है. I mean ultimate because there is more or less the what examiner want. Why are we doing postmortem on PGI paper? So that we know requirement क्या है, what is the requirement of examiner इसके लिए. But anyway, you can do the corrections of the frame of the questions and exactly what examiner gave. If you have taken the PGI exam, you can post it under the bottom of the blog. you have a space where you can put the comments. We will really appreciate that. So you can close the door. That smoke is coming. Yeah. Lorazepam, midazolam, alprazolam. No, midazolam and clobazam. They are the ones. Alprazolam generally used as an anxiolytic. If you take tenazepam, even tenazepam also is intermediate acting in nature, and that's the reason it is more often used mainly for the short-term treatment of insomnia and also for its anxiolytic property. For that matter, every benzodiazepine has an anticonvulsant action. But we don't use alprazolam and tenazepam for that particular purpose is what you need to basically remember. This is a beautiful question. What are the rational fixed drug combinations? We see lot of over-the-counter medications. What do they contain? Cold hai. Will patient go to doctor for cold? No. He'll go to medical shop. एक अच्छा दवा दे दीजिए. पूरा सर्दी चले जाना, नाक भी चले गए तो अच्छा है. So he will give him one which is containing paracetamol, antihistamine, right? And vasoconstrictor of the nasal mucosa like phenylephrine. If patient wants, he can add one diclofenac also inside that and mix it and give. So they are called irrational drug combinations. Ibuprofen, serratiopeptidase is combined. But ibuprofen need not be combined with serratiopeptidase actually. Serratiopeptidase is what generally whenever you have any infection, cellulitis, etc., it will help a better penetration of a drug. Similarly, we combine pyrade and enalapril very commonly, ACE inhibitor, but they said that is not a rational fixed drug combination. But trimethoprim sulfamethoxazole, piperacillin, tazobactam, they are called as rational fixed drug combinations. The remaining are irrational. So there are the various fixed drug combinations which are commonly given. Out of that, what did FDA approved as a rational fixed drug combinations? Imipenem, cilastin, ampicillin, sulbactam, piperacillin, tazobactam, sulfadoxin, pyrimethamine, and amoxicillin, clavulanate, and sulfamethoxazole, trimethoprim are the drugs which are considered to be rational fixed drug combinations. That is what you need to basically remember. इसको आंसर करने के लिए कुछ पढ़ाई का जरूरत है नहीं है, प्रिपरेशन का जरूरत है नहीं है, तो आप नहीं प्रिपेयर हुए तो भी 50 क्वेश्चंस आर सपोज्ड टू बी आंसर्ड extempore, so that examiner will know are you really medical student or not, or are you a robo, है ना. तो वो जांच करने के लिए 50-60 क्वेश्चंस का प्रिपरेशन की जरूरत नहीं है. वहां आप कैसे गेस मारते हैं वो सब इंपॉर्टेंट है, मगर रिमेनिंग 150 आउट ऑफ 200 क्वेश्चंस इफ यू से फॉर 200 पेपर, उसमें 120 क्वेश्चंस टू 125 क्वेश्चंस टेलर्ड फॉर्मूला क्वेश्चंस, इसमें एक पॉइंट रहता वो मालूम है तो आप आंसर करते. लाइक प्रोस्टेट, बिनाइन प्रोस्टेटिक हाइपरप्लेसिया, इट इज अराइजिंग फ्रॉम सेंट्रल एरिया ऑफ प्रोस्टेट. तो ट्रेडिशनल क्वेश्चन है वो, मालूम होना है आपको, नहीं है तो कैसे देते सीट, नहीं देते. रैपिड सैंड फिल्टर का पार्टिकल साइज मालूम है तो कैसे देते हम सीट, नहीं देते. पिट लैंटरिन का डेप्थ मालूम नहीं है तो कैसे देते हम, अरे उतना इजी दे देते क्या. हाँ, 20-25 questions not in your hands. Simple, any entrance, any number of years entrance is conducted, same story doctor. Okay, so इसलिए आप ज्यादा एंजाइटी, ज्यादा टेंशन, ज्यादा गिल्ट फीलिंग के साथ एग्जाम गए तो वो 50 क्वेश्चंस जहां आप कॉमन सेंस का इस्तेमाल करना है ना, वो मर जाएगा. So keep your mind open, cheerful. Use a guesswork. Have confidence on yourself that you are a good student. First, keep biofeedback. I am a good student. I am going to crack it because I cracked the pre-medical exam. वो 50 questions, that's important. Remaining 150 में 120 आपके मेहनत के वजह से आते. 20-30 questions किसी के हाथ में नहीं है. So ultimately your score must be between 75 to 80% of the maximum score. You will get C. That is the magic of exam. तो वो 120, 125 क्वेश्चंस जो 200 में आंसर करने के लिए that 1132 टॉपिक लिस्ट which we have given वो पढ़ के जाना एग्जाम को. उसको पढ़ने के लिए कितना घंटे लगेगा? 5 to 6 टॉपिक्स पर आवर. सो 200 आवर्स में खत्म हो जाते 1132 टॉपिक्स. 200 आवर्स कैसे मिलेगा? रोज 5 घंटे पढ़े तो 40 डेज में खत्म हो जाता. सो वी जस्ट रिक्वायर 40 डेज ऑफ योर टाइम. 40 is a favorite number for Lord Hanuman. They do one mandalam of puja to Lord Hanuman. So 40 days, 5 घंटे, only 5 hours. Don't be a monkey but a homo sapien praying the god Hanuman. So 5 hours in a day for 40 days, 200 hours आपका टाइम दे दो, 1130 टॉपिक्स खत्म करो, एग्जाम को जाओ. वो 120 क्वेश्चंस फटाफट आंसर करते, 50 क्वेश्चंस अच्छा गेस करते, 20 क्वेश्चंस छोड़ देते भगवान को. 155, 160 आराम से आ जाएगा. नहीं तो टेंशन है, ये है, नोटिफिकेशन है, क्या करना है, काउंसलिंग में सीट आएगा या नहीं, वो सब छोड़ दो, रिजल्ट को छोड़ दो, रिजल्ट आएगा ऑटोमेटिकली. नाउ डॉक्टर, व्हेन टू एलील्स आर इनहेरिटेड टुगेदर, व्हाट डू यू बेसिकली कॉल? एलील इज allotype. So antigenic determinants specified by the allelic forms of the Ig genes are basically called as allotypes. Similarly, what is an idiotype, isotype, etc.? I leave the literature for you. Now, isotypes means they are the distinct forms of the light and heavy chains which are present in all members of the species but coded by different genetic loci. Allele means between two chromosomes, 21, 2 21s है. 21 में ये एरिया में शॉर्ट आर्म में वन जीन, corresponding short arm of the another 21 chromosome में the same gene is called allele. Alleles decide, then you call allotype. On the same chromosome, two different genetic loci decide, then they become isotypes. So accordingly, you should know what is isotype, allotype, idiotype, etc., etc.